Hi, I'm Amy Olsson. I'm a midwife with Midwifery Care Associates at Simmonds, Martin, and Helmbrecht in Frederick. I see patients exclusively in the Frederick office and I deliver at Frederick Health Hospital. That's a good question. We provide the same prenatal testing that the doctors provide. It's a great way, it's all based on evidence-based care for what is important to find out each trimester. And it's also a way for us to decide the level of care that you would need during your pregnancy. Do you need an extra support by the physician team, or do you need to maybe see maternal fetal medicine, a perinatology team? So these are all very important tests that we do. In the first trimester, you'll get what's called your NIPT, which tests for Down syndrome, trisomy 13 and 18, and also has a option to find out the gender of your baby. And we can do that as early as 8 weeks. We also offer carrier screening in the first trimester, which different levels that can test for many different diseases that you may be a carrier of. And if you're positive for any of those, then we would test the father of the baby to see if he also is a carrier. And then we would go forward with any results there. In your second trimester, we start with the alpha fetoprotein, or the AFP blood test. And that's just a simple blood test that checks for protein in your blood that would be present if your baby has spina bifida. Sometimes there's about a 3% false positive rate on that test. And so sometimes it's positive, and then we would do further testing and say that, okay, it looks like it's just a false positive. The other test we do is at 20 weeks, you have your anatomy sonogram. And so that's what the pictures, takes the pictures of all the baby's parts and measures everything, make sure everything looks good there. At 28 weeks, you have a big visit where you come in and you do your glucose tolerance test, which takes 1 hour, and that checks for gestational diabetes. There's going to be another visit or another video that goes into that a little bit further. We also check you for anemia at that visit. And if you're Rh negative, you would get your RhoGAM during 28-week visit. In the third trimester, we check you for a bacteria in the genital tract called Group B strep, or GBS. And so that's one test that happens at 36 weeks and determines some management decisions that would happen when you're in labor. So those are the basic prenatal tests that we do that would be the same as the doctors. So again, I'm Amy, and I'm with Midwifery Care Associates in Frederick office.